Hi, my name is Dean Nicholas. I'm an associate professor and program director at Drexel University, and I'm also the founding director of the Drexel Design Research for Health Clinic. We are a group of people who do evidence-based design in the urban environment through participatory practices. Myself and my co-designers are all from Drexel University, and I'm excited to share our poster with you for this year's conference. Over the past 40 years, healthcare as buildings, products, and services, and the roles they play in our lives and the environment have become more intricate. The focus of design in health has changed to include data and research-driven processes, and our lab focuses on community as a driver for that. We have several projects that we are working on that have arisen from long-term community participatory practices. This case study poster presents several project-based examples that undertake participatory health and design research to implement novel solutions for improved care and placekeeping in a major American city. A bit more about the lab and the participatory work we do. The Drexel Design Research for Health Lab and the Design Health Innovation Clinic is engaged in evidence-based design and design thinking to improve how people and care are connected through spaces and services. Our work fills gaps in care, homes, living, and other arenas. The research utilizes participatory design thinking to create evidence-based spaces, places, and services that can connect people to care in their communities. I believe all spaces should have an evidence-based well-being focus, and I've developed a research-driven process that I call insightful design thinking, involving community spatial observation, assessment, biodesign, and design student mentorship to develop in-home solutions for urban aging in place and health. Through the public-facing arm of my lab, the Design Health Innovation Clinic, I undertake current projects, including an analytical tool for the retrofit of homes for aging in place and climate preparedness, biodesign for aging, and care kits for those who are aging caregivers. I also produce scholarship in the design and health innovation sector and scholarship of teaching and learning on interdisciplinary team innovation. We in the lab are extremely interested in what age-friendly care looks like in the 21st century. Central to that is the idea that not only the patient, but the caregiver needs care. And we use a research-driven framework that I developed, as I mentioned, called insightful design thinking. The process incorporates community spatial observation, comprehensive assessment, biodesign strategies, and design student mentorship. And it's central to our community-driven culture for care process. Participatory design requires designers to create materials, facilitate sessions, and analyze the outcomes as part of their design process. When done well, this leads to spaces, places, services, and products that meet the needs of the community, center care, and give them strategies and tools for their future. This is important to give longevity to solutions that are valued by all. Insightful design thinking, as I mentioned before, is an adaptive and complex process of empirical observation that centers on a primary process that I've developed called slow engagement. Slow engagement is all about boots on the ground engagement with community, resource awareness, positioning ourselves within the work, and being flexible about how the work lays out. Within this emerging ontology of design praxis and research, novel complex topics and processes give communities and researchers the opportunity to learn how to engage deeply with 21st century problems we all face, including aging in place and design for aging. Second Story Collective, our main community partner in this work, is a collaborative venture, a collective of artists and scholars, activists and architects, and West Philadelphia residents that is united by a vision. Shared living space and shared stories can create a foundation for meaningful cohabitation. For the past 7 years, my lab, along with Second Story Collective, have used art-centered processes engaged in community-driven research. We've developed partnerships to make our vision of alternative housing an actual thing in the world, and we're working to create a sustainable, transferable model for co-designed, equitable development, particularly for historically marginalized communities. The main work that I've undertaken with the community of Mantua and Second Story Collective, which is primarily where we work, is examining how folks can age in place and co-creating solutions, health-driven solutions for their spaces. Through many sessions, we realized that people want to age in place and be creative in their homes, and they want to maintain strong ties to their community. Many are caregivers who experience health issues and as caregivers, they need support. We co-developed an analytical tool that allows us to go into the homes of those wanting to age in place, give them a report that we then help them retrofit with funding that we've gotten. Often older homes are the subject, and in Philadelphia, the housing stock is row housing. And this makes it safe to stay in place as long as possible. The importance of aging in place is supported by research. Maintaining creative processes and connection with community while one ages is also an important component to a long and healthy life. Our tool is developed for this community and others to be able to do that. Thank you so much for taking the time to watch my presentation. I hope you have a great day.